Hey everybody, my name is Dr. Scott Giacomucci, and I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And today I want to talk to you a bit about the content from Chapter 4 of this book, which focuses on trauma-informed experiential sociometry processes, which are action-based group tools that we can use to make groups more engaging and more effective. And these tools come from the field of psychodrama. So I'm going to go through a series of different sociometry tools, and I'll explain them to you verbally, while also including some video clips that you can use to see them visually in case you're more of a visual learner. And then I'll also talk about some best practices for keeping these processes trauma-informed and preventing re-traumatization while you're facilitating them. So these experiential tools can be used in any group setting, including therapy groups, support groups, community groups, organizational meetings, supervision groups, and educational settings as well. When we're thinking about sociometry, it's important that we're also considering the warming up process as it relates to psychodrama and the work that we're doing. So in psychodrama theory, we first start with the warming up process, then we move into action, and then we end with some sort of integration or sharing. So when we're using sociometry in a psychodrama group, we're using it mostly for warming up. And there's some important considerations to keep in mind in terms of the warming up process as it relates to working with trauma survivors. So in a traditional psychodrama group, the warming up process could be pretty quick and we would move right into a psychodrama. However, I would recommend that when we're working with trauma survivors, especially folks who are earlier in their recovery journey, that it would be important that we take our time in the warming up process, that we don't just speed through it and jump right into a psychodrama, but that we really give the warming up process the time that it needs to effectively and adequately warm up the group. Folks who have experienced trauma are going to need a little bit more time to warm up than folks that have not experienced trauma. And we could even think about the very symptoms of PTSD as relating to a deficiency in spontaneity or a blockage that prevents us from accessing spontaneity, the energy that gives us the ability to have adequate responses to new situations and new responses to old reoccurring situations. And in psychodrama theory, the warming up process is all about helping us and helping our clients tap into spontaneity. So when we're working with folks that are experiencing PTSD or CPTSD, the warming up process is likely going to need a bit more time than usual. The warming up process, when we're employing sociometry, this is where we're cultivating that safety and we're cultivating the group cohesion. We're helping the group connect to each other and develop connections to the content, to the process. This is where oftentimes we use warm-up processes that involve some playfulness and some humor, and they allow group members to let their guard down a little bit and start to feel safe in the group, to connect with others. So the warming up process is particularly important, and these sociometry tools really help us to cultivate effective warm-ups with our groups. At the same time, these sociometry tools could also be used as the action phase of a group if we're not using psychodrama or sociodrama. So they're pretty versatile, and there's even creative ways we could use them to promote sharing in the third phase of psychodrama. So some of the processes we're going to cover in this video include the use of small groups, dyads and triads, the use of spectrograms, locograms, floor checks, step-in sociometry, sociograms, and the circle of strengths. And I want to talk about the 6 trauma-informed principles from SAMHSA as they relate to these processes, because these experiential processes inherently embody many of SAMHSA's trauma-informed care principles. And at the same time, as we're facilitating these processes, it would be important for us to keep in mind SAMHSA's 6 trauma-informed care principles to keep the process safe and effective and mitigate any risks for re-traumatization or causing harm. So these sociometry processes can include pen on paper exercises such as social atoms, role atoms, and sociograms, which we're not going to talk much about in this video. I've already posted some other videos that explain and demonstrate those pen to paper exercises. Instead, we're going to focus mostly on the experiential sociometry tools in this video. So these tools can be used at any stage of group development for psychoeducation, for engaging the group, for assessing the group, for offering interventions and therapy techniques within the group process, and also for evaluation at the end or at important milestones within the group's development. So they really are pretty versatile. They're especially important because they help us cultivate safety and that group cohesion, which is so important in groups and in group therapy. But they also provide the facilitator with some really important information about group dynamics and about where the group is and where individuals within the group are. So the first trauma-informed principle is safety. And these sociometry processes really give us an avenue for cultivating safety in the group, for helping participants develop connections with each other and start to feel safe within the relationships and the matrix of relationships within the group. We can't do any good therapeutic work without first establishing safety. It would be irresponsible for us to dive into trauma content or trauma reprocessing or powerful cathartic work if we haven't first established safety in the group. And that's exactly what these sociometry tools allow us to do and give us tools to cultivate within the group. So by positioning group members in ways that they can support each other and they can get to know and learn details about the other participants in the group, while in short increments sharing a little bit about themselves, we start to promote transparency and trust while cultivating safety. So that second trauma-informed principle of trust and transparency goes right along with safety. And really all of these 6 trauma-informed principles are connected to each other. It's hard to talk about them separately because they're all intertwined with each other. So sociometry tools help us develop trust within the group and trust between group members, as well as trust with the facilitator and the other members of the group. So they illuminate some of the sociodynamics or the group dynamics that are underneath the surface and sometimes right on the surface within the group. And they help participants develop more awareness of where they fit in within the group. So sociometry tools really allow us to cultivate that mutual aid and peer support within the group process. And so peer support is the third trauma-informed principle. And so sociometry is really unique in that it allows us to cultivate peer support in quick and efficient ways within the entire group. Instead of one person talking at a time during sociometry processes, we can have multiple instances of peer support and mutual aid occurring all at the same time. So it really maintains a group as a whole experience while promoting multiple instances of peer support concurrently. The fourth trauma-informed principle is about mutuality and collaboration. So sociometry processes, particularly the ones we're going to talk about in a minute, they help group members develop a sense of belongingness within the group, help them feel less isolated and disconnected. And sociometry also helps establish a sense of co-creation and mutual respect, that each person in the group has something important to offer to other group members and to the larger group process, and that through sociometry we're going to help extract that and pull that out and create space and opportunity for that to emerge. The fifth trauma-informed principle is about empowerment, voice, and choice. And because sociometry is inherently full of choices and amplifying the group voices as well as individual voices, it really helps participants feel empowered and gives them opportunities to practice making choices and to use their voice, to talk about what they prefer, what they want, what they need, and what they're warming up to. Sociometry helps us not just empower one group member, but it really promotes a sense of collective empowerment in the group process. And the sixth trauma-informed principle is all about identity, culture, gender, and historic issues. So sociometry allows us to explore and address issues related to identity within the group process. And we do that by looking at shared experiences and different experiences in a gradual and non-threatening way. So we can use prompts within our sociometry processes that relate to culture, that relate to race, that relate to gender, and issues of oppression. And this helps group members connect with each other based on shared experiences. The very nature of experiential sociometry is anti-oppressive in that it disrupts some of the traditional power dynamics within group therapy. Instead of focusing on the group therapist as the expert and as the person in power and the therapeutic power resting solely in the facilitator's hands, sociometry processes really dismantle some of that and instead put the therapeutic power and agency within the hands of each group member. And so in this way, they are inherently anti-oppressive. In talking about sociometry tools and talking about trauma-informed care, it's important that we keep in mind a 3-stage clinical map for safe and effective trauma therapy. And you'll find other videos on this channel that go into that 3-stage clinical map in detail. So I'm not going to do that in this video. But just as a quick refresher, there's 3 phases to this clinical map. Phase 1 is all about safety, it's about strengths, it's about connection and psychoeducation. So phase 2 is all about the trauma, the grief, the rage, the anger, the defense mechanisms. It's where we get to the more difficult content. And phase 3 of the clinical map is about integration and about growth and about the future. So how are we taking what we've learned and integrating it into our lives beyond the group? So these are the 3 phases of the clinical map. Start with safe, easy, strength-based, positive prompts. Then we move into the more difficult prompts related to trauma or the group goals or topics or issues. And then we end with future-oriented integrative prompts, perhaps related to post-traumatic growth. So it's important to keep in mind this clinical map before we start to talk about some of the specific sociometry tools.